Hi, and welcome to my live today. So every Thursday, I will be here at 2:30 p.m. PST. I hope you can join me today or next few Thursdays, and also look at some of the videos I posted for the last few weeks. So today we will be exploring a subtopic on women's health, that is UTI, or urinary tract infection. So let's look at the background and statistic here. Acute UTI is a common bacterial infection that affects 40% to 50% of women at one time in their life. So if you are a grown adult, you probably have had one experience of UTI and have taken antibiotics or other help to help it go away. And the statistics also say that between 20 to 30% of women who have had UTI will experience a recurrence. So that's really not a good news for us. And also around 25% will develop ongoing recurrent episodes with implications for their well-being and impact a higher healthcare cost. We don't like that. In biomedicine or Western medicine, antibiotics are often prescribed and can prevent recurrent UTIs. However, there are growing concerns about microbial resistance, side effects from treatment, digestive problems, and lack of long-term benefit. So more and more alternative treatments are being investigated to treat UTI. Here, I'd like to shed some light on the use of Chinese herbal medicine and its long recorded history for treating UTI symptoms. I will also post a more recent research of potential role in the management of recurrent UTIs using herbal medicine. You can see the link below after the video today. So hi, I see you here. Okay, thank you for coming live. Let's look at the organs involved in UTI. So although we often refer to a UTI as a bladder infection, any part of the urinary system, including the kidneys, can become infected. The most common infection, however, is in the bladder and also the urethra. UTIs are more likely to affect women as our female anatomy sits within or inside our body, unlike, of course, men's, which is on the outside. In my clinic, I see many women who suffer from repeated chronic UTIs. The main symptoms of a UTI are burning sensation when urinating, frequent and urgent urination with a reduced amount of urine, blood in the urine, strong smelling urine, or cloudy urine. So some of these factors that can cause you to have UTI can be, let's see here, of course, dehydration and not enough fluids in the body, certain type of birth control pills, and the use of diaphragm, having a new partner and being sexually active, a diet high in sugar and carbohydrates. In my previous life, I think like a week ago, you will see my topic on the Candida diet. If you have missed it, check it out for a list of recommended foods to eat and to avoid, and also best practices to prevent Candida. So a history of kidney stones can also cause UTIs, overuse of antibiotics, low immune system, and if you have pre-existing conditions such as diabetes or kidney problems. For women over 50 years old, UTIs can become more common as our yin or estrogen dwindles. In Western and biomedicine, and in also Chinese herbal medicine, we look at both treatment using antibiotics and also herbal medicine. So if you suffer from recurrent and untreated UTI, please contact your physician right away, as this can lead to kidney infection and in long term can damage your kidneys as well. In herbal medicine, acute UTI is attributed to a few underlying imbalances in the body. We divide them into dryness, not enough yin or low estrogen, especially in postmenopausal women, too much damp or too much heat in the constitution, and lastly, bacteria infection. Chinese herbal medicine is part of the umbrella of traditional Chinese medicine. Here we use a mixture of a complex herbal formula, usually comprising of 10 to 15 herbs delivered as decoction, which is infused in water, in capsule, or in pills form. So herbal medicine formula may be standardized or customized according to your needs. We use a system of diagnostic that is different from the bio or Western medicine, as we differentiate according to presenting signs and symptoms. So what does that mean to you? So when you come to see me, I check your tongue, I check your pulse, and I ask you a series of questions pertaining to your sleep, your diet, your bowel movement, your sexual practice, and more to find out what patterns you show the most. Then I will either prescribe 1 to 3 kinds of formula for you to take. So for example, person A might take a different herbal formula than person B, as both presenting symptoms are different. So there is no one size that fits all for our Chinese herbal formulation. So instead of giving one person one type of medicine, we prescribe the herbs according to your presenting symptoms. So if, let's say, person A have more of a damp and heat condition, such as more itching, more burning, more pain during urination, the formula that I could possibly prescribe are like Bachan San or Dianthus formula. And for person B, they come to me and the symptoms are more acute but silent. That means no itching, no pain, but frequent urination and cloudy urine. I would prescribe another formula such as Jian And if you have recurrent UTIs, that does not go away, then I will use a stronger formula called Sanjun Pian. I know all the names might sound foreign to you, but no worries. The Chinese names derive from the main herbs in the formula, and for me, I understand it quite easily. So whatever it is, the good news is this. Chinese herbal medicine has been used to treat UTI symptoms for over 2,000 years. Recent clinical studies suggest that it may alleviate UTI symptoms and reduce 1 year post-treatment recurrent rates. It may also reduce post-recurrent rates from 30% when antibiotics were used alone to 4.4% when antibiotics and herbal medicine work to combine. So in short, in combination with antibiotics and herbal medicine, we can help to lower the recurrent rates drastically. The studies here that I will post in a few minutes also suggest that herbal medicine used either on its own or with antibiotic treatment may be more effective than antibiotics alone for relieving acute UTIs and to prevent recurrent episodes. And if you still have doubts, see the link below for the studies that I have collected for you. So here are my suggestions if you have been fighting UTIs. Number 1, always consult your physician if your symptoms have not gone away or have gotten worse. Also, take the herbal formula such as prescribed earlier on at the first sign of a UTI. Ask for advice when picking the right formula for your condition. Not all herbal formula will work the same way for everyone. Next, come in for acupuncture treatment. Acute UTIs often respond very well to acupuncture and herbs in combination. So do both of them together for at least 5 to 10 times. Drink plenty of fluids, of course. Avoid coffee, tea, and alcohol. Avoid any sexual intercourse. Practice self-cleanliness, such as peeing after intercourse or washing as soon as possible, and tell your partner to do the same. Wear cotton underwear or loose clothing to help air circulation. And you can wear a skirt instead of tight pants or tight jeans. Limit sugar, white flour, and simple carbohydrates. After urination, wipe from front to back to avoid spreading germs from the anus to the urethra. Avoid any vagina deodorant, oils, or any lubricants. So I hope this information is good for you, to help you and give you some ideas of some alternative treatments to consider next time you experience UTI. As the studies shown that using antibiotics alone will not be as helpful as in a combination with herbal medicine. And also remember, you are not alone. Many women had in one time suffered from UTI. So the more we can share what works and what does not work, will help each other to live a happier and less suffering in our life. And thanks for watching. Leave me any questions on the message box. I hope you have a great week and see you next time. Take care now.